Yeah, so we were fortunate to be sort of a key contributor to the ongoing ARC-20 trial. We look at the activity of Casdatifan, an oral HIF-2 inhibitor in treatment-resistant renal cell carcinoma. So HIF-2 inhibitors are sort of evolving in their role in treatment of renal cell carcinoma with approval after immunotherapy and VEGFR for belzutifan. And it's similar to how we have multiple TKIs. The hope is, can we build upon the efficacy with other drugs? And so Casdatifan is a novel oral HIF-2 inhibitor, which is being studied in a phase 1 trial. And so what we see here is updated analysis from data that was presented earlier in the year by Dr. Schwery, showing that Casdatifan certainly has activity in treatment-resistant renal cell clear cell renal cell carcinoma. And I think what really stands out is disease control rates over 80%, with that PD as best response looking encouraging, albeit small numbers, only 60 patients. So I think really exciting early results and supports the ongoing development of Casdatifan in terms of efficacy. The second point, what we look at the data, is it really did solidify 100 milligrams daily as the dose that should be studied in ongoing trials. And then toxicity. As we have all these new agents, toxicity is really important, right? So we don't want to subject these patients to a drug that may help shrink the tumor, but they feel horrible. And so really no new toxicity signals seen with Casdatifan. And it is important to note, like, HIF-2 inhibitors are not VEGF-TKIs. They have a unique toxicity profile. Hypoxia is number one. Patients may have to not feel it, so it's important to do pulse oximetry. And the second one can be anemia. And the anemia is an on-target effect. And so you can manage that with use of ESAs, plus or minus iron, or transfusions, and or dose reduction as a whole to sort of optimize this overall. So I think really exciting data. Ongoing cohorts are looking at the combination of Cabozantinib with Casdatifan in anticipation of the development for the PEAK-1 trial, which will look at Cabozantinib plus Casdatifan versus Cabozantinib in those patients with treatment-resistant renal cell carcinoma.